Lauren, can you give me permission to record Spanish recording?
You're live, Brian.
Thank you. Good evening, Mono County, and thank you for coming to our COVID community conversation for January 13th, 2022. It's been a while since we've been on this format, but we have a lot of information to cover tonight, so we'll get right into it right after I introduce our panel for this evening. I would like to first introduce Dr. Karen Slack, our new public health officer. And then we also have Stu Brown from the town of Mammoth Lakes. We have Dr. Burroughs from Mammoth Hospital. We have Emily Janoff, who is the epidemiologist for Mono County Public Health. We have Ron Cohen from Mammoth Mountain. We have our CAO, Robert Lawton. From the town of Mammoth Lakes, we have Dan Holler. Fire Chief Frank Freevold is with us tonight. Deputy Director of COVID for Mono County Public Health, Jennifer Burroughs. Superintendent Dr. Jennifer Wildman from Mammoth Unified School District. And that is our panel. We also have some supporting cast. We have IT members and interpreters as well. So thank you all for being here, and let's go ahead and jump into our presentation for this evening. Thank you, Stu. As we mentioned, it is the community conversation for January 13th. Let's go to the next slide. All right, we're going to have Emily, our epidemiologist, speak to some of our first slides as they show a lot of graphs and statistics and numbers that she's been working with for 2 years now. Emily?
Thank you. Good evening, everyone. All right, so first off, this is a graph that's showing the growth in total positive PCR confirmed cases in the past 30 days. At the bottom, we can see the total cases is at 2,313. There has been a 30-day increase of 562 cases, representing a 32% increase. It's worth noting that while the portal is reporting PCR confirmed cases still, we are internally tracking positive antigen tests that are reported to us, and we're including them in current case rates. Next slide. Thank you. So on the left here, this is taken directly from the COVID portal that most of you have probably seen before. On the right, we're looking at positivity rate. So the positivity rate is reported to us by the state as we are unable to obtain an accurate real-time denominator for that metric. It's reported with a lag of about 2 weeks before they can kind of get that together and aggregate it and get it to us. So currently, they're reporting through the end of December, and we have a positivity rate of the county at 43%. So this means that of all the PCR tests that are being ran on Mono County residents, 43% of them are coming back positive. Next slide. Okay,
Emily, can you just pause for a little bit for this interpreter to catch up?
Sure, sorry.
Don't feel bad, Emily. I forgot as well.
It's tricky. Do you want to give me a cue when we're good?
You should be good now. Just slow it down a tiny little bit. It helps them to.
Sure thing. Oh, okay. So this graph here is showing the population adjusted case rate per 100,000 for the past 8 weeks. This is the same metric that we've been using dating back to the blueprint system instituted by California Department of Public Health last year when we were doing all the reopening. You can see the last reporting period that's complete here is January 2nd through January 8th. We have a case rate of 446, which is definitely a record. On the right, the red numbers there are raw case numbers for the past couple of weeks. So as the case rate goes up, just because of the math, it starts to get off a little bit, but population adjusted on the left, raw case numbers on the right. Some reminders down there of what we're looking for, what we were aiming for. I think the bars moved a little bit, but let's see. Craig, do you want to discuss the hospital a little bit here?
Yeah, thank you. So just so everyone's clear, the hospital status is green. And what that means is that we are able to take care of anyone that comes in the door that needs to be admitted for any kind of attention. Like just about everybody else in the entire area, we are impacted by COVID in the sense that we're seeing a lot of patients coming into the clinics and to the emergency room with symptoms and looking to be tested. We have our own staffing issues because just like everywhere else, we have people that are out sick. That does not mean we cannot take care of patients. We have full capacity to care for anyone in the hospital. And for that matter, if they have to be admitted to the hospital, we do everything in our power to keep them in our facility as opposed to transferring them out. Just because you have COVID and you get admitted doesn't mean you have to be transferred out. Again, a lot of things that have happened over the last 2+ years, we have come to appreciate what is required to manage a patient with COVID. And like any other patient that comes into the hospital that is critically ill and requires attention, that's going to need a higher level of care than what we are normally able to provide, those are the people that get transferred out. But a COVID diagnosis all by itself does not necessarily mean you're going to be transferred out. We have cared for an innumerous amount of people that have required admission. They've been on oxygen. They've been on the other treatments that we tend to use to take care of COVID patients. And they wind up doing just fine, and we wind up discharging them. It is possible they could be in the hospital for a few days or even upwards of a week or more if they need be. But if there's no need to transfer them out, just like any other condition that we have, our goal is to try to keep them in the hospital in Mammoth as much as possible, because that's clearly easier, more convenient, and more practical than transferring you upwards of 200 miles away from where you either live or you're staying or you're visiting.
Okay, I'll pop back on for a second. So this is a graph that's depicting basically what we call an epi curve dating back to November of 2020. And I included it. I think it does a good job of highlighting the large number of cases that we're working with right now. So our CICT team is amazing, but small. And we do not have a reserve of people to assist in our efforts during surges like the one that we're seeing now. We're averaging 42 new assignments per day that we're doing our best to reach out to, provide isolation instructions, offer resources, etc.
Emily, can you clarify what CICT is for?
Sure. I'm used to throwing acronyms around. So that's going to be case investigation and contact tracing. So this is kind of fluid, depending on what the caseload is at any time. But our goal is to be able to reach out to anybody that's received a positive test, make sure that they have accurate information of how to proceed, give them, like I said, resources, let them know when they need to reach out for other help if their symptoms are worsening, and then also what they can tell people around them. We're not at a point in the pandemic anymore where we're able to collect contacts of positive cases, reach out to them, provide them quarantine instructions, and whatnot. So it's really an important way for us to just get that communication between the health department and the positive case, make sure that everyone knows what to do, is on the same page, and if they're going to need, a letter to get back to work, or if they have questions about follow-up testing, things like that can be answered during these calls. And I can attest that our team is cranking away. I'm currently getting emails from our CICT team asking questions. I mean, they're working basically round the clock to try to reach all these cases. And I think we can go to the next one. Okay, so this is just a breakdown of positive cases from about the last month that's showing the age distribution. Just of note, you can see at the top here that 27% of the recent cases have occurred in the under 18 demographic, which is just a shift from what we're used to seeing, earlier in the pandemic. And we do see that the majority of the cases are occurring in that 30 to 49-year-old demographic. Next slide, please. Thank you. And here is a breakdown of OptumServe testing data for the past 3 weeks. This is the free state-run testing that is offered up at Sierra Star. And this is just to show that a good portion of the positives that are coming back from this community testing up there are not actually Mono County residents. While those positives are not counted in our case rates, it is concerning that so many resources are being used by folks from out of the area. We're going to, touch on this a little more later in the presentation, but we're going to be offering some additional testing dates this upcoming weekend that will be specifically for Mono County residents in an effort to alleviate the strain on resources that we're seeing in the community. And that's it for me. Brian, I'll pass that back to you.
All right, thank you very much, Emily. Let me move things around here so I can actually see. This is just the COVID dashboard from the state. Correct, Stu? And it's showing vaccines administered in that first block, and the second block are total number of cases. The third block, and this is all over the past 8 weeks. The third block is the deaths, and then finally the positivity rate of 23% over those last 8 weeks. Next slide, please. All right, so I know there's been a lot of confusion around the new guidance for the 5-day guidance for isolation and quarantine, and there were already adjustments made to that. So if an individual tests positive, they should stay home for at least 5 days. That's your isolation period. If your symptoms resolve or resolving, the guidance is to take a diagnostic specimen, and an antigen test is preferred. You don't want to do a PCR because PCRs will often stay positive for quite a while. So you want to get that antigen test. If it's negative, you're good to go. You want to wear a mask, of course. If you're unable to test or choose not to test, and symptoms are not presently resolved, then you're supposed to isolate for 10 days. Also, if a fever is present, isolation should be continued to the fever resolves. Let's go to our next slide. All right, so if you're exposed and you are unvaccinated or vaccinated and, sorry, it gets confusing, vaccinated and booster eligible, but have not yet received a booster dose, the guidance is to stay home for 5 days, test on day 5. Quarantine can end on day 5 if symptoms are not present. You're urged to take a diagnostic test at day 5, again, an antigen test. If it's negative, you can proceed back to work, but wearing a mask. If you are unable to test or choose not to, again, you are to do the full 10 days. There is some language on here that's quite important. You do want to wear a well-fitting mask, and we do recommend at this point with Omicron, with it being so contagious, that an N95 or a KN95 is your best bet to prevent illness and exposure. We go to the next slide. So if you're exposed and you're boosted or vaccinated but not yet booster eligible, all that's required is you test on day 5, you wear a well-fitting mask around others for 10 days, especially in indoor settings, which everyone should be doing other than at home anyway right now. And then, of course, if you do happen to test positive, you follow the previous guidance for testing positive. And again, just to clarify for everyone, isolation is when you test positive, quarantine is when you've been exposed. Let's go ahead to the next slide. All right, so this is just the vaccines that have been administered. So first doses, 8,986. People that are fully vaccinated, that's 8,670. Approximately 78% or 67.9 or basically 68% are fully vaccinated, with 6.8% of the population partially vaccinated. This data only includes vaccines administered by Mono County and the hospital. This data does not contain the doses delivered by Vaughn's or Rite Aid or other pharmacies. As you can see, though, booster-wise, that third dose, we have administered 3,520 plus third doses, which is good. We'd like to see that number get much higher, obviously. So again, we encourage people that haven't boosted, get out there and booster, because it is the best way, along with masking, a good fitting mask to protect yourself from this very contagious variant. Next slide, please. All right. Emily, did you want to speak to this graph?
Oh, Dr. Burroughs, I think.
It's in here for Craig, yeah.
Okay,
Yeah.
Go ahead, Dr. Burroughs. My apologies.
So these also are off of the California website for COVID. And what this demonstrates, without trying to make a big plug for a mandate for vaccination, is really the reason behind why we are encouraging people to become vaccinated and then boosted, for that matter. So for people that are fully vaccinated, and for the sake of argument, that's going to be the people that have had 2 of their shots, plus or minus the booster. On the left-hand side is the likelihood that you're going to get hospitalized. And on the right-hand side is the likelihood that you're going to die from COVID. So as you can see on the left-hand side, unvaccinated people are 8 times more likely to be hospitalized. So that's kind of the gamble you're taking if you choose not to be vaccinated, is what could be a mild illness, very typical cold symptoms, certainly what we're seeing with Omicron, can translate into having to be hospitalized with the same virus that otherwise would just be the inconvenience that is having a cold. And then more concerning is the fact that if you're unvaccinated and you get seriously ill, you are almost 21 times more likely to die from COVID than someone that is fully vaccinated. That to me is the big push as to why you be vaccinated. Never mind any requirement of you must or a mandate or anything like that. It's simply dramatically improving your odds that you don't have to get admitted to the hospital. And even more important, you're not going to pass away from this.
Thank you, Dr. Burroughs. Let's go to the next slide. All right, so this is just a neat little graph on eligibility for vaccine for the different vaccines. So with Pfizer, you can certainly, as you see, ages 5 and above can get Pfizer, and boosters as well for 5 and above. So, I'm sorry, for boosters, it's 11 and above, I believe. And for Moderna is still only for those that are above the age of 18, and Johnson & Johnson as well. But overall, 5 and above can get a Pfizer series. Next slide. And this is just some of our, we have one more clinic on the schedule right now. We will be getting more schedules together for the month of February and the end of January. I would encourage you to tune into our COVID portal so you can check out our schedule to see when we're testing and doing vaccines. One thing to take note of is that subject to change due to weather, right? We're here in Mammoth. If we have big storms, we may not be able to get to a certain destination, as you know, when we had the the last storm, we really weren't able to get out very much. And I believe Justin just put the portal link in the chat. Thank you, Justin. Next slide. All right, so just a reminder for everyone that masks are required by the state, a state health order, through February 15th. It was originally January 15th, but due to all the cases, it has been extended. Also remember that Mono County has a mask mandate already in place. And again, you want a well-fitting tight mask. An N95 or KN95 would be preferred. You want to use that, prior also to attending events. Attendees may be required to provide proof of vaccine or a negative antigen test, depending on what events you are going to. A negative PCR within 2 days of certain events, large indoor events, as well as some of the large outdoor events. We're not really having much in the way of outdoor events other than skiing at this point. So let's go to the next slide. All right, and speaking, this is the mask up for MLK weekend. An effective mask is both good fitting and has good filtration. As you know, you want to have that properly fit mask tight around the nose and around the chin to prevent any virus from sneaking in and infecting you. You want to make sure it's worn over your mouth and nose. You often see a lot of people with their nose hanging out. That's not the way to use a mask. And again, we recommend getting a KN95 or an N95. There's a nice little chart about exposure and how long it would take to potentially get infected. As you can see, if you're not wearing a mask or a cloth mask, you can see the time is 15, 20 minutes. With the surgical mask, 30 minutes. With an N95, look at that time you have. So that's why we're saying wear a KN95 or an N95. It's the best way to protect yourself. It's going to be a busy weekend. There are going to be a lot of people here. So try to get a well-fitting, high filtrating mask. Next slide, please. All right, so our testing schedule, OptumServe OptumServe is Tuesday through Saturday, starting on February 1st. Until the end of the month, they will still be Tuesday, Wednesday, and Friday, Saturday. But again, the first of the month, they will move to Tuesday through Saturday. So that's good. We'll have more opportunities to test. That is 11 a.m. through 7 p.m. at Sierra Star Golf Course. You are well advised to pre-register. They have been experiencing very high volumes, and my understanding is that a lot of walk-ins have been turned away because they are full. You see the link there for pre-registration.
Brian?
I'll pause.
Just to note, Brian, they've started Thursdays as of today.
Oh, they did. They moved it up?
Yes.
Thank you very much. My mistake. So it is Tuesday through Thursday. I'm glad that they changed that. We do have some special testing this weekend provided by the state of California by their outbreak response team. That will be for members of the community in Mono County only. That is Saturday and Sunday from 9 to 5 at the Mammoth High School. And again, you will need to bring some form of proof of residency. And again, there's a pre-registration link down there. So again, well advised to pre-register. And again, thank you, Jen, for that update. I was unaware of that. We will be in Memorial Hall in Bridgeport on the 19th doing some pop-up testing. And again, stay tuned to our portal for updates and further scheduling. Next slide, please. And this is just some resources for you as far as our COVID information and our Facebook and our COVID help email. Next slide, please. All right, Dr. Slack, would you care to speak to this slide, please?
Yes, so good evening. I'm going to read the order, Mono County order for a temporary closure of in-person instruction at the Mammoth Unified School District facilities. And this was in effect as of, the order went January 8th, 2022. And it ordered the temporary closure of in-person instruction and indoor activities within the Mammoth Unified School District, Mammoth High School, Mammoth Middle School, Mammoth Elementary School, Sierra, I can't read this, Sierra High School, Husky Club, Mono County Office of Education's inclusive preschool on the campus of Mammoth Elementary School. This closure is in response to the dramatic increase that we've heard about earlier in this presentation in the COVID-19 cases and the resulting impacts on staffing and resources on the local schools. Mammoth Unified School District facilities will be closed for in-person instruction and indoor activities beginning Monday, January 10th, and may reopen for in-person instruction and indoor activities ending on midnight of January 28th. This order does not apply to school-related activities that are conducted outdoors. Next slide. I will pass this off to Dr. Wildman, who is in attendance tonight, to talk about the executive order supporting safe in-person learning that the governor signed Tuesday, January 11th.
Yeah, the governor did sign a new order, which was intended to relieve some of the substitute staffing issues that we have. We are required to provide a certificated substitute in every classroom. Last week, we had 17 full day absences with no sub provided. Basically, we could not find substitutes. And so we have a wonderful staff who fills in, but we are required on an ongoing basis to have qualified subs in our classes. And so this was really intended, I think, to help alleviate that problem across the state. But we are pretty unique in being very small and remote. So some of the things that other people might find relief from, for instance, allowing student teachers to sub, or releasing some of the requirements of retired teachers to sub, won't help us because we don't have very many of those people. And the other thing that this order did was to relieve the timeline for applying for new substitute teachers. We only get a dozen new substitutes per year. And the timeline flexibility will be helpful if we get a new sub, but the requirements to sub are exactly the same as they were. So there's been no change in requirements. We still require a bachelor's degree. They still have to pass a basic skills test or coursework that shows basic skills. We still need to have clearance through the Department of Justice and live scan fingerprinting. So, and we still need to obtain a temporary teaching certificate. So the requirements we're maybe going to help a bigger school district that might have more of these kind of influx of substitutes, but I'm not sure it's going to provide very much relief to us here in Mammoth.
Thank you, Dr. Wildman. Next slide, please.
That is the end of the presentation, Brian.
Okay. Well, then we will open up to questions. Can we have our first question?
When will mask enforcement happen at Vaughn's grocery outlet, etc.?
That is a tough question to answer. It is really hard to station people at Vaughn's, you know, be it the sheriff or MLPD, to enforce masking. It's a difficult situation. It's a staffing situation. Vons is open 24/7 and has 2 entrances. So you would be taking away a large portion of the sheriff's and the police department to cover that. Dan, can you speak to that a little bit?
Yes, thank you, Brian. Dan Holler. We've looked at the different options for the masking enforcement and stuff, and as noted, from a resource standpoint, it's very difficult. Also, it's really been placed more almost on it's a requirement, but not one that we've stepped up in the various businesses to enforce. We've had conversations with local businesses, asking them to remind people to state it. But given a lot of the pushback and the conflict that comes out of direct confrontations, that enforcement, frankly, has been limited, both from resources and just from the interaction that tends to occur in those environments.
Thank you, Dan. Why don't we take our next question?
Why are masks not required in the Mammoth Mountain Gondola? They're required at most resorts in the country and Canada as well as Europe.
Go ahead, Ron.
Yeah, thanks for the question. Yeah, we've had this discussion consistently through the entire pandemic. At one point, they were required by state regulation. They're not now. There is definitely a different treatment among different resorts across the country. We consider gondolas outdoor space and want to continue doing that. If you are particularly concerned about riding the gondola, you can mask up. On days that aren't busy, you can ask for a ride on your own. And on other days, almost the entire ski area is serviced by chairlifts, and you can opt to stay outside for the entire time that you're out skiing. So, the other approach to that is to try to do exactly what was just asked about bonds, and have enforcement and require people to wear masks. And when we do that, we know from past experience that leads to ongoing confrontation and really destroys everybody's experience, including our employees. We don't want our employees to be mask police. Our employees don't want to be mask police. And so we really ask people to be responsible for their own health. Wear a tight-fitting, high-quality mask when you're on the gondola, if that really matters to you, if that feels risky to you. If it feels too risky for you, you can ride chair 1, chair 2, chair 23 and stay outside. No, you will miss skiing on Dave's Run, but almost the entire rest of the mountain will be, pretty much the entire rest of the mountain will be available to you entirely outside.
Thank you, Ron. While we're talking about enforcement, we do have Sheriff Braun in the audience. Are we able to let her speak or promote her for temporarily? There she is.
Gotcha.
Good evening, Sheriff.
Good evening. I need to have my husband mute his computer. Or walk away. Okay. We had a little bit of an echo going on there. So as to masking in businesses and on the mountain and enforcing that, we've been doing this for 2 years now, and it's people are going to mask and people are not going to mask. People are going to follow the rules. People are not going to follow the rules. This is not something that is going to change. So you have to be responsible for yourself and your own behavior. So if you're in a situation where you're uncomfortable and somebody's not masked, walk away from that situation. If that means not riding the gondola, it means not riding the gondola. We will enforce the criminal laws that go alongside with these things. So if somebody causes a scene or lays hands on somebody, something to that effect, then we'll enforce the criminal aspect of it. But we can't be everywhere at all times. And the Vaughn's staffing, we all realize how short staffed they are. You've stood in those lines. They don't have somebody to stand there at the door and make sure that everybody wears a mask. So take care of yourself, be responsible for yourself, and remove yourself from situations where you're uncomfortable.
All right, thank you, Sheriff Braun, greatly appreciated. Why don't we move on to our next question?
Skiing is an event. Why are they not testing prior to skiing?
I'm sorry, can you say that again? It was a little hard to hear that.
Sure. Skiing is essentially an event. Why are they not required to test prior to skiing?
Go ahead, Ron.
Yeah, all I can say is from a state law perspective, our understanding is entirely different. Skiing is not an event. Skiing is an outdoor activity. When there were guidelines for operations from the state during the blueprint, skiing had its own guideline under the outdoor activities that was specific to it, and it was never considered an event at that time, and it's not considered an event now.
Thank you, Ron. Let's move to our next question.
How many of the 19 teachers absent were asymptomatic? Has the school thought about only having classes with absent or sick teachers go virtual?
Dr. Wildman.
Mm-hmm. We have done that in the past. We've had certain classes have to close and have those teachers go virtual. But we had sort of a combination of events happening last week. Not only did we have 19% of our teachers out on average every day, we also had up to 300 students absent. Last Friday was an example. We only had 80% attendance of students. And so we, in the move to remote learning, even though I know everybody, including our teachers and staff, would rather be in person, we moved from 80% absence rate on Friday to 96% absence rate yesterday on distance learning. So it is a move we have made in the past to put teachers on distance learning. Some of our absent teachers are not COVID positive, but have a child who's COVID positive, or their own childcare closed because of COVID. And so we have several reasons for teachers to be absent. It's not always that they personally have COVID. And so we always try to find a substitute or try to find a way to make that happen. But as you can imagine, a middle school teacher being absent and her third period class has to go virtual with no substitute, there's nowhere for those students to go. So in many cases, it's not practical for us to just throw people up online for one period.
Dr. Wildman, just a question. How is attendance during this remote learning period going?
It's actually better than our average attendance when we're in person. So 96% yesterday. I didn't check today, but we had about 315 kids absent on Friday, and yesterday we had 47 kids not come to remote learning. So our absence rate has definitely improved. We'd still rather be in person. We'd rather have 96% of our kids in person, but our normal absence rates, even when we're not having a COVID surge, are at about 90%. So we actually have had more students online than we usually have in person.
Great, thank you, Dr. Wildman. Why don't we take our next question?
Why is the school the only thing in town that is being restricted? And with such high rates in both locals and visitors, do you foresee limitations or closures in the future?
Dr. Wildman.
I could answer that a little bit. One of the ways that a school environment is different is that obviously we have a lot of little children, and so our decisions really affect our kids and how they go through their day. I happened to bump into a father and son at the Whitmore Animal Shelter, really nice people, and we were talking through distance learning and how are you doing and how can we help you? And one of the things the person said is, oh, I work at a restaurant. We've been closed because of staffing. We haven't had enough staffing. We had to close down. And so I think there are places that are closed intermittently for different reasons related to COVID. And this is just the time where we were impacted most last week. And with staffing and with cases, we also had to close. So I think that, you know, that's just the way it goes right now with Omicron. Sometimes you hit a surge and an impact is great in your business, just as well as it is in our schools.
Thank you so much. Next question. Oh, I'm sorry. I see Frank has his hand up. Go ahead, Frank.
Thank you, Brian. Yeah, I would just concur with Dr. Wildman. I can speak for the fire district. We have made adjustments in our staffing model and working remote and restricting access to the fire station, obviously where people are, you know, both living and operating, and then also based on high patient contact. So I concur that there's probably actually a lot of adjustments and restrictions being made, but many of them may be at the employment site level.
All right, thank you, Frank. Why don't we take our next question?
How many of the new positive cases are vaccinated and or boosted?
Emily?
Sure. Hi. So, you know, we are tracking this to the best of our ability. There are some limitations to that. The breakthrough rate with Omicron is high, and we know that. We're seeing that, I think, anecdotally with the people around you, and the data is showing it. But I think the focus really needs to remain on the vaccination status of the people that are requiring hospitalization, experiencing severe illness, and dying from COVID. And that is still predominantly occurring in the unvaccinated population. Another point would be that, you know, being vaccinated, even again, you know, with the Omicron variant, you're still likely to clear the virus faster, you're infectious for less time, your viral load is lower. This is all stuff that's being looked at and the data supports it. There's no reason to think that you should not be getting vaccinated just because of the change in the variant. So to answer the question, a lot. I haven't looked at the numbers lately because it honestly kind of stopped to seem to matter, but we do have that information, but that would be my answer. I don't know if Craig has anything to add to that.
No, I agree with that completely. Thanks. Absolutely.
All right, thank you both. Ingrid, I see your hands up. Did you have a comment? Oh, her hand's down. Okay, next question, please.
Why was the 3-week time frame selected to shut down the schools?
Dr. Slack?
Again, I know that is the burning question, how we came to the 3-week time period. The school district and California Department of Public Health, Mono County Public Health, we all met on Friday, the 7th of January, and discussed the fact that, as you saw, the positive case rate had gone from the 100s into the 400s over the time span of a week. And this also concurred with what the school district numbers were showing. The thought was that this was going to increase. The request for testing had increased, and we were seeing, you were seeing sick kids and sick teachers and staffing shortages. So at that point, the decision was, if it potentially could increase another week to a peak and then start decreasing, that put out the week of the 10th and the week of the 17th, combination with events happening on the mountain, the weekend of the 8th and 9th, and a holiday weekend of the 15th, 16th, and 17th, with the thought that there would be an influx more of tourists to the mountain that potentially would bring in more virus this weekend, knowing that today in LA County, they had 45,000 new cases, positive cases. So that is why the week of the 17th and then the 24th, thinking that the rates would still be high. All of this said, we monitor the numbers every single day. And the challenge that we now have is that the labs, the Valencia State Lab, where these tests are going, are lagging in their turnaround time for about 5 days. So our current data that we have right now dates to Saturday, January 8th, and we're already going into Friday, the 14th of January. So we won't get this week's numbers until the middle of next week. And you can see how we're trying to make accurate decisions with a lag in data, and we do not have real-time data. So, but every day we review the numbers to see if indeed the peak is earlier than what we had modeled. And if the peak is earlier and plateaus, it's something that we are considering that potentially the return to in-person could be adjusted. It all depends on what the numbers show. Hopefully that answers your question.
Thank you, Dr. Slack. Dr. Wildman, just a question. Are there other schools in the state that are currently doing remote or have closed?
I was just looking at that again. There are a few more every day. There are about 5,500 schools across the nation that are closed right now for remote learning because of COVID, for COVID reasons. Fresno County and Hayward went to remote learning at the same time as we did. Alpine County announced last night that their schools are closed and they've had several cases. And just now, Lake Tahoe and Carson City both went to remote learning. So I think, you know, we opened before many schools did. After winter break, we opened January 3rd, which is pretty early. Most of my friends, superintendents just went back on Monday. So we're probably gonna see a slow kind of roll to some remote learning of other districts as we go along. This is pretty overwhelming. Our resources weren't set up for Omicron. So as the dozens and dozens and dozens of cases came in, our system was pretty overwhelmed. Absence rates and substitutes and contact tracing. So I know LA Unified staff and students are up to 80,000 cases today. So if we're lucky, we're in this nice little place where we don't have to deal with tens of thousands of cases in the schools.
Thank you, Dr. Wildman. Let's go to our next question.
Other districts in California have allowed asymptomatic positive students to attend school. Why have our quarantine guidelines been so strict?
Dr. Wildman.
I'm so sorry. Could you repeat the question? I was answering a question in the chat and I missed it.
Sure.
I'm trying to chat answers or the question and answer thing, the Q&A.
Sure. Other districts in California have allowed asymptomatic positive students to attend school. Why have our quarantine restrictions been so strict?
That our CDPH guidance does not allow us to have COVID positive people in our schools. So we are not allowed to have staff or students who are COVID positive. There's a 5-day isolation requirement. On day 5, we test with a rapid test. And if you test negative and you don't have symptoms, you can come back. If you test positive, you have to continue on through day 10. So that guidance has not, as far as I'm aware, Dr. Slack and Brian, I'll defer to you, but we are following the guidance that we were given.
Yes, that's the guidance.
Indeed. Thank you.
It's a little different for the hospital personnel. Dr. Burroughs, if you wanted to highlight the differences.
Yeah, hospital personnel is a whole different story for a lot of reasons that are probably obvious, but certainly when the pandemic first started, one of the absolute priorities was to try to keep the hospital safe and prevent it from being a vector of spread. For that reason, employees in the hospital, and this has kind of fallen apart with the Omicron variant as well, but employees were kept out for 10 days. Now, when we didn't have the absolute onslaught of people being sick all at the same time, it was a lot easier to say, well, you need to be out and we have enough staff that you can continue that you can stay out for all 10 days. The CDC has certainly modified that guideline for healthcare personnel. And let me emphasize healthcare personnel only, that if you are exposed, or even if you contract the virus and you are asymptomatic, there is not a requirement for you to be able to work in healthcare for any period of time. That being said, if you're exposed, or certainly if you test positive, we are doing everything in our power to be able to identify you. And if you're not what we consider to be critical staffing, we will keep you out. We are trying to keep our staff out of the hospital and prevent them from working. There are certainly situations and circumstances where someone has to work, or other people are going to, specifically patients that are sick that need attention, are going to suffer and not get the care that they need. So that is a very unique and different environment than everything else that we're talking about right now. And I'm sure I confused the daylights out of everyone right now, because I'm equally as confused about it.
Thank you, Dr. Burroughs. Let's go to our next question, please.
I think you guys have covered this, but there's several questions in the queue. Why are restaurants, bars, ski mountains, and special events allowed to remain open while the schools are closed?
Dan, do you want to speak to the businesses?
Yes, the community's been retained to be open. We have not had businesses coming forward requesting to be closed down or to be modified, versus where the school district really had those challenges in terms of staffing and the number of children that were coming up with positive COVID tests, being quarantined or isolated. So there was a significant public health impact on the schools. Businesses are, I'll say, self-regulating based on impacts in terms of the hours that they are operating, in terms of how they're managing staff in those areas. People are definitely out absent in those types of environments. And so we haven't taken that step, because once that question comes up, you'd walk through each one and we'll look at those health metrics and whether it be a single business by business versus a business sector. We did go through all of that, the height of the pandemic, some months back. Different type of growth in the variant at that point between the original COVID and the Delta variant. And so I think the element here has been, given the sickness levels, given what's happening out there, and again, what we're seeing, kind of a self-regulatory process with businesses in terms of modifying hours to meet their work demand. We do see that out there, the encouragement to businesses to have their employees wear masks as they're working. Again, they can encourage people coming in to mask up as well, which helps. So we're not looking at an overarching shutdown. That question would be, well, which businesses are impacted, which ones aren't, to be that same process we went through some time ago. And I think the impact and what we're seeing from the public health side with this current surge in this variant is different in its makeup and its structure. And the impact on the community on the other side of that would be extremely dramatic at this point.
Thank you so much, Dan. Let's go to our next question, please.
Just to clarify, do you expect any further guidelines or regulations on any businesses?
I can speak to that again, Brian. We haven't seen anything coming out to really regulate additional businesses at that level, down to the business level or the type of business. We're not anticipating in putting any additional regulations in place at the town or county level. If there is a particular area where there is a significant health issue, such as we saw with the schools, and that would be done on a case-by-case basis based on a request and discussion with the various business. So in monitoring the state information and even other areas, we're not seeing that level of action being taken. Some local communities are being more aggressive in particular areas, but we do not see that coming here in the town of Mammoth Lakes or in Mono County.
Thank you, Dan. Let's go ahead to that next question.
With the change of the variant that is a weaker strain, it appears we are seeing more cases with people testing positive with no symptoms. Given that we have entered a different period of dealing with COVID with a weaker strain and vaccines available, is there any chat of changing how we collect data? For example, can we begin to identify COVID positive with symptoms and COVID positive without symptoms?
Dr. Burroughs, would you like to address that question?
No, I would not.
I tried.
But I'll try. I think that would be a really high ask of anyone to collect that. It's hard enough to keep track of people that are positive and do contact tracing, and the additional requirement to say you're positive and symptomatic versus positive and asymptomatic. I think we just don't have the manpower to do it. I think it's the best answer I can give. And I think the reality is that most people, if they're positive, the reality is that they have a high enough viral load that the tests turn positive and they are still contagious. They can transmit it to other people, and that's the bigger concern. Not, well, if you're positive and asymptomatic, does that make you different? Good for you for being asymptomatic, but no, you can still spread it to other people.
And I can add on to that a tiny bit. We do actually, with our contact tracing team, attempt to get that information. So it is a field on our standardized form that we kind of go through and fill out when we reach out to positive patients, is asking them when their symptoms began and what their symptoms are, or if they're asymptomatic. So it is something that we're doing our best to track in our contact tracing, our local tracking platform that we use. Again, there's limitations to that, but we are looking to, there was a while where that was kind of a big thing that we were looking at. And I can say personally, just from what I see within our collected data, there are not as many asymptomatic cases as you would think. And I think that's because we're at a point where people don't test until they're symptomatic. There's a lot of things that kind of get in the way of that, but it is something that we attempt to collect.
And I saw Dr. Slack, you had your hand up.
Yeah, the issue is data collecting on all of this, because when you test for COVID, you ask a certain set of questions, then the lab processes the result, releases it back, and then the question is matching what pieces of paper you might have on the receiving end for that lab result. And again, it's a lot of manpower to do that, and sometimes doesn't always get reported as well.
And I think the other reality is, by the time when you first present and you test, you may have been asymptomatic. By the time we get the result back, you may now be symptomatic. So just another confounding piece of that is, where do you fit now? And I think most people have some symptoms after they test positive. It may not be immediately, but within a couple of days, you probably have it. And fortunately, within a couple of days after that, you don't, for the most part.
Thank you, doctors, and thank you, Emily. Let's take our next question.
If Mono County schools are not allowed to have COVID positive asymptomatic students in schools based on regulations, how are other schools allowed to?
That is a good question. I wish I had the answer to that question. I do know when I go on to forums with other superintendents that there's a variety of attitudes, and feelings and beliefs about the virus and mitigation efforts. And, I know just from listening to people that they don't always follow the guidance, but we are really, really good about keeping our kids and our staff safe here, and we follow the guidance given. And so I can't really answer for another person that doesn't follow the same guidance.
Thank you, Dr. Wildman. Next question, please.
Why can't we access the vaccine data from Rite Aid and Burroughs?
We do actually get that data. It just comes in a different format. I can't, it doesn't come divided out. It just on the dashboard for California for Mono County, there's a tab for that's just Mono County, and then there's a tab that is Mono County and federal. So the pharmacies fall under that federal portion of it, and it's not broken down, but it is included in our overall percentage of individuals that are vaccinated. Next question, please.
Since the vaccines are not very effective at preventing transmission, as evidenced by the fact that positivity rates are very high simultaneously with vaccination rates, their utility is primarily to benefit the individual receiving them, not the public at large. Thus, the vaccines are functioning more like a treatment for illness rather than a traditional vaccine. In this manner, they are similar to chemotherapy for cancer, but we do not mandate people taking chemotherapy. So why all the mandates for this vaccine?
Dr. Burroughs, can you address some of that information or question, I should say?
Yeah, I can. This is my personal belief on this, and I've said this multiple times. I even put a video out on this not too long ago. Never mind the mandate for the vaccine, and we showed this slide earlier. The benefit of getting vaccinated is you avoid being hospitalized or dying from this illness, from this virus. The mandates are coming from some other power that I don't have any control over. That's the state requirement, regulation that we also, as under the jurisdiction of the state of California, are required to follow and have to be compliant with that. But from an individual perspective, again, if you're 21 more times more likely to die from having COVID, I don't know why you wouldn't get vaccinated. That being said, we have spent the last 2+ years trying to do everything in our power to prevent our systems from becoming overwhelmed. And I think we've done a remarkable job of that. And the fact that we can care for anyone and everyone that comes in and provide care and and give them what they need speaks to that. I think it's a reasonable argument to say that at this point in time, you choosing to get the vaccine or not, you probably already made your decision. I mean, we're 2 years in, and if the vaccine rate is not 100%, then there's a reason for that. And some people have decided I'm not going to get it. And you know what? I'm going to say, okay, that's the respect that you deserve as an individual to decide what you want to do or what not want to do. From a purely scientific or medical perspective, I can only tell you that it is to your advantage to get vaccinated and prevent yourself from getting really, really sick or dying. And from a perspective of your community members, if you wind up getting hospitalized because of COVID, you're potentially taking up a bed that someone that has another condition can no longer take up. And it bogs down the system. And that's just the plain simple truth of what we're looking at right now. That's irrespective of what you believe or don't believe about the government controlling your aspects of what you should do. That's as clear an answer as I can give you as to why you should get vaccinated.
Thank you, Dr. Burroughs. And Dr. Wildman, can you speak about vaccine requirements for schools, just so the crowd has an understanding of that?
Yeah, right now our only vaccine requirements were for ages 16 and up, per the approved Pfizer vaccine, and we have a requirement for our staff to be vaccinated, and there are no other requirements at this time.
But can you speak to the overall requirements?
The overall,
meaning, there are a whole host of vaccines that
other requirements. Oh yeah. So sorry about that. The state of California has 10 vaccines that are currently required for school attendance. There used to be in California personal belief exemptions, and those ended a number of years ago. We have to report all of our, not have to report, we have to use a state database to gather information about vaccinations that students have given, and we are not allowed to admit to school anyone who hasn't had their regular childhood vaccinations. Thank you.
Thank you, Dr. Wildman. And those guidelines have been in place for quite a while. Why don't we go to our next question?
The ski resort is attracting visitors to our community, which can potentially carry the virus. The schools cannot be open. Why isn't there limits on occupancy of a ski resort? Isn't there a risk to our community?
Go ahead, Ron.
Well, there are no legally required capacity limitations for skiing. Skiing's an entirely outdoor activity. We don't think that the right thing to do is limit skiing. That said, the number of people who are coming to the ski area right now is not anywhere near the high levels we've seen in the past. We've certainly had busy days, and we've certainly had a lot of people in town. And we'll have people in town, people own second homes, people rent locations. They're going to come here. This is a tourism location, and it always has been. And so, of course, there's a risk. But again, best way to mitigate that risk is to take personal responsibility, not to do it through government regulation. So we can mitigate the risk by, if we're particularly concerned, by getting vaccinated and boosted and reducing our chance considerably of having a serious health outcome from an infection. We can mitigate risk by wearing a tightly fitted, high quality mask. And if we're particularly concerned, we can mitigate risk by avoiding crowded areas. So those are all things we can do as a piece of personal responsibility if it's something of greater concern for us. I think, ultimately we're a tourism economy. So many people here depend on that. This isn't the situation we were in over a year ago when closing businesses was backed up by federal government money, when putting people out of work was backed up by federal government money. None of that exists anymore. The government has put into place, from a broad perspective, systems that assume that we're going to be in business and doing the things that people rely on in order to make their living and make ends meet. And so I am not in favor of that kind of limitation. I think we can handle that with personal responsibility, not with mandates or government regulations or other heavy-handed approaches. We can do this together, and we can take that responsibility on ourselves successfully.
All right, thank you, Ron. We only have a few more minutes left, so let's see if we can get to a few more questions before 6:45. Next question.
Is it possible to get bonds and grocery outlets some support, perhaps the National Guard at the door, to distribute, educate, and enforce masks?
I'm sorry, could you read that one more time?
Yes. Is it possible to get bonds and grocery outlets some support that is not law enforcement to distribute, educate, and enforce masking?
We do provide outreach to them when, if we get complaints or if people have concerns, we do reach out to the businesses, provide them education, provide them with signs, give them best practices. So there is that support, and there always will be that support. But putting law enforcement in front of these buildings is just not feasible. Let's go to our next question.
Yeah, real quick, Brian.
Sorry, Dan.
Sorry, they asked a question about the National Guard there too, and we don't control them. They were actually dispatched by the governor's office under his authority to different places. And I believe the ones that were dispatched, there's only a few that in Mono County to help out OptumServe and testing. I believe they have been reassigned. They're no longer here, is my understanding. I think we had maybe 3 or so is all. So they're really not available at this point. I think Jennifer may have additional information on their status here in the community. Thanks.
They are still here, and they will continue to be here for up to 8 weeks. They are here specifically to provide extra support for testing and registration. They were sent to us, as Dan Holler said, by the governor's office in California Department of Public Health. And that is because we have the highest COVID rate in the state. And so the governor's office and public health is identifying these counties with high case rates and sending extra support to help them with testing and the burden on public health to try to keep up with the demands.
Thank you, Jennifer. Frank, did you have your hand up?
I had to find the mute button, sorry. One last plug on the vaccination piece. You know, we're dealing with what's in front of us right now, but I don't know who said it, but it was obviously a great line, is, you know, the viruses make their living off of mutating and evolving. And one of the other benefits that we know the data will support is limiting of the time and severity as you've got the virus. And when we've got so many people infected, you know, we're kind of flirting with spinning off additional variants in the future. So it's not just about the here and now that's in front of us, but part of the reason we're here is because we had some very high caseloads globally. And we just, eventually, if we're going to stop this process, we've got to get a handle on this, and vaccinations will support that. Thank you.
Yeah, we definitely need to vaccinate beyond our borders. We need to get the world vaccinated to cut down on those variant factories, as you spoke of, Frank. Very good point. Let's go to our next question.
How long are you contagious after testing positive? What is the purpose of a PCR test with a result 3 to 5 days later? What's the availability of rapid tests currently now? And can you go over the new quarantine and isolation guidance?
Yeah, those are some tough questions. You're right. With the lag in test result times of PCRs, it's a tough situation. The state lab is totally overwhelmed. There's also a shortage of antigen tests. So it is definitely a tough situation. Dr. Burroughs, would you like to add to any comments to the situation?
Yeah, I mean, we've talked about the notion and tried to encourage people that if you're symptomatic, given what we're dealing with right now, there is an overwhelming likelihood that this is from the Omicron variant of COVID. So like anything else, we would ask, and boy, if there's any lesson to be learned from this pandemic, it's like, if you're sick, please stay home and isolate. Don't give what you have to other people. As far as the PCR test is concerned, so the PCR test will pick up active infection, but it will also pick up non-active infection. It's picking up genetic material from the virus that may no longer be actively replicating or reproducing itself and then having the ability to spread to other people. So the difficulty with the PCR test as you get further and further out from when you had symptoms is you don't know if you're identifying a prior infection or a brand new infection. The antigen test, on the other hand, is very good at picking up active live virus. So if you test positive with an antigen test, and certainly with what we're looking at right now, the need to confirm that with a PCR test is really much less than it was a year ago, 2 years ago, when we weren't sure exactly how to interpret the antigen test without confirming it with a PCR. In fact, now we're allowed to submit antigen tests as positive for COVID without having to send a confirmation with the PCR test, which is the more sensitive test. So regardless of when you get your result back, the antigen test is really reflecting active virus and you're brand new infected. The PCR test, the further you get out from when you became symptomatic and when you tested, is now can be positive for up to 90 days. So it's hard to know what that means, especially if you're testing way beyond when you were symptomatic and if you were recovered. It's probably telling you had COVID, but it's not necessarily saying you have active COVID right at the moment.
Thank you, Dr. Burroughs. I see, Ron, you have your hand up.
Yeah, thank you. You know, I want to address that question about PCR and rapid. And a lot of what, I'm not a government person, I'm a business operator. I am a lot of what's underlying a lot of these questions. And, you know, should we force people to do things? Are the tests valid? Why would you take that test if the result doesn't come fast enough? And I keep coming back to the same thing here as a member of the community, as a business operator, personal responsibility. And it's where so much of where this lies at this point as we make this transition from pandemic to endemic. And, we're, a lot of people on the call, 186 participants, a bunch of people on the screen. A bunch of us are skiers and riders. And we know that skiing and riding has inherent risks, up to and including death. And we do it anyways, because we like the personal freedom that's involved and thrill that goes with it, and outdoor activity and all those things. And we do what we can to be personally responsible to mitigate those risks, to not endanger other people. And all those same lessons are all right here for us as well. As a ski area, we have a policy on vaccination for our employees. We don't require it. We encourage it. We can see without broad societal mandates, 80% of Californians are vaccinated or on their way to being fully vaccinated. Over 70% have had 2 shots, and 8% more have taken the first. So a lot of Californians have taken the personal responsibility to take the vaccine, not all. I'd encourage those who don't to start that journey, get that vaccine, for all the reasons that Dr. Burroughs and others have stated. As a business operator, I'm very reluctant to use the employment relationship to force people to do that. I think people should get there on their own as they see their friends and family suffer, their unvaccinated friends and family suffer really serious illness. They might reconsider that decision. I would hope so. Same thing with testing, personal responsibility. Just as Dr. Burroughs said, you have symptoms, most likely right now with the transmission of Omicron, most likely you have COVID. And so it's your responsibility to say, hey, I have symptoms. I'm going to isolate. The CDC and others have shrunk the quarantine period to reflect the current status of this virus. So you're not stuck at home for 2 weeks. Most likely it's going to be 5 days. And so we really carefully and consistently encourage our team to speak up about symptoms, to not come to work, to assume that symptoms are COVID and that the test is merely a confirmation of that. So I think, as we go forward as a community, my message would be, don't look to the town or the state or the CDPH or anybody like that to mandate our way out of this issue. It's up to us, and each one of us can do almost everything it takes to avoid getting COVID. Not perfectly. There's always a chance that we're going to get it. Just like there's always a chance that we're going to wipe out and get hurt on the hill. But if we take that upon ourselves to take a personal responsibility perspective, we can do a lot better as a community and be a whole lot less divisive in asking why one group's not forcing another to do something. Thanks for that.
Thank you, Ron. And unfortunately, we are out of time for this evening. I do want to thank all of the panelists that are here. And I want to thank all of the attendees and attendants and everyone in Mono County who's helping us get through this incredibly challenging time in our lives. Yeah. So until we meet again, take care of yourselves and each other. Good night, Mono County.